This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. And if you've been dealing with foot and ankle problems, well, there's a new procedure now available to you. It's ankle replacement surgery. Today we're going to be meeting one of the newest surgeons at Aurora, also a podiatrist. It's Dr. Thurmond Lanier. Well, thank you for joining us today. You know, I think a lot of people have heard about knee replacements, but I think ankle replacement, that's something new to people. Who would basically be a typical patient that would need an ankle replacement?
Sure. Well, the typical patient is generally over 50 years of age. They've had debilitating end-stage ankle arthritis and have tried conservative therapies. Also, they would have good bone stock to hold the implant in place. And they also wouldn't have had a major infection in the past 3 months. They would also have some sort of understanding about some of the activity modifications that they would need to have after getting the implant in their ankle.
Yeah, I mean, is it similar in terms of a knee replacement? I mean, when I say most people know about knee replacements, you know, the pain that's associated with that, is that the type of patient that would actually have to have an ankle replaced?
Yes, it's very similar to an arthritic knee. The only difference is that most of the time arthritic knees come from what we call primary osteoarthritis, where it's just kind of wear and tear. But in the ankle, usually patients have some sort of traumatic incident that incites the arthritis. So the mechanics of it are very similar. It's just kind of how you get to the end stage of it, which is different.
Yeah, what's the benefit of having that ankle replaced?
Sure. So typically the standard of care now is an ankle fusion, and that takes away all of the motion at the ankle. But the ankle replacement will help the patient preserve the ankle motion and also get rid of the pain.
Yeah, it seems like, you know, there's a lot of bones in the foot and the ankle. I would imagine you're able to save the foot in most cases?
Yes, for the most part. And with an ankle fusion, you put a lot of stresses on those bones in the foot. But with an ankle replacement, you preserve that motion, and so the stresses that are going through the foot are less with an ankle replacement as with an ankle fusion.
Yeah, and I would imagine there's quite a bit of rehab involved in this. How long is the recovery period?
It is, yeah. So typically this procedure is performed in an inpatient basis. You generally stay in the hospital for 1 or 2 days, and then the patient begins range of motion exercises with their ankle, and then they're off of their feet for about 4 to 6 weeks, and this allows for the bone to ingrow into the ankle implant.
Yeah, and once the patient is healed, are there activity restrictions after an implant?
There are. The main activity restrictions are high impact activities, so things of nature like basketball or tennis, usually patients can't perform just because of the impact that it would have on the replacement. Most of the time they can do things like hiking or jogging or golfing, and patients usually enjoy these activities after the ankle replacement.
You talked about a fusion. Are these things typically, are they pretty common that you go from a fusion to a replacement?
Yeah. For the most part, is either or. Most surgeons would perform the ankle replacement or the ankle fusion. In very rare instances, some patients have had an ankle fusion and they are not either fused in the right position or still have continued pain, and then we can take down that fusion and actually put in an ankle replacement instead.
Yeah, and how long does a replacement typically last then?
It lasts about 10 to 15 years. Every now and then we do have to go back in there and revise, maybe change the little spacer that's in between the implants. But for the most part, if the implant is seated correctly, the activities are stayed away from that we talk about with the patient, it's generally 10 to 15 years.
Yeah. Are there other treatments that are available to patients that are having ankle problems?
Sure. For the most part, you want to do conservative care first. So you want to try to change shoe gear or use ankle stabilizers. Also, cortisone injections and anti-inflammatory medications can be used. And other surgical routes are, like we talked about, an ankle fusion, and also arthroscopy to kind of clean out the joint as well.
Yeah, it seems like it's major surgery, and I would imagine a patient would probably go quite a while with pain before they actually decide to have an ankle replacement. And what should the process be for a person considering ankle replacement? Do they go to their primary care physician, or do they need to seek you immediately?
Yeah, first of all, they should go to their primary care physician, because a lot of times they can just do ankle braces or anti-inflammatory medications, and the primary care physician can provide this. If that's not helping with their pain, then they should be referred to a podiatrist or an orthopedic surgeon who has experience with taking care of ankle arthritis. And at that point, we can decide whether more bracing or a scope or an ankle replacement would be the right thing for them.
All right. Well, we know you're new to the area, and we wish you the best of luck, and thank you for taking some time with us today.
Thank you so much for having me.
So if you're dealing with foot and ankle problems and you'd like to meet with Dr. Lanier, you can get a hold of him in Oshkosh at 303-8700. He's also seeing patients in Fond du Lac at the Aurora Health Center. You can reach him there at 907-7000. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.